Hi, my name is Kelly, and I have a Tfcc repair. It's by my ulnar bone, and I had surgery. You can't really see it too much. It's kind of dark in here. I'm sorry. I'm just relaxing right now because I had surgery Friday. It's a week after surgery now. It's still starting to feel better. This is my other wrist. I have two wrists that have the Tfcc tear in them. I've been going through pain for 2 years. I've been going to doctors, many doctors. Nobody knew what it was. I went to an orthopedist. I went to a rheumatoid arthritis doctor. I went to a neurologist. I went to a chiropractor. I went to, what else did I go to? There's another doctor that I went to. I can't remember. It's been ongoing for about 2 years now. And I went to a rheumatoid arthritis doctor. He put me on Cymbalta, made it help a little bit. He thought it might be fibromyalgia, but it's not fibromyalgia. It's only two wrists. Fibromyalgia doesn't work that way, and I don't have a lot of the other symptoms of fibromyalgia. So it wasn't that. And I just kept on. It was like they were passing me from doctor to doctor. And I couldn't take it anymore. It was just awful. And then they put me on Cymbalta. And they put me on a high dosage. And it made me go crazy. Cuckoo. And it just was awful. I was so depressed. I couldn't write. I could barely do my work at school. I was so nervous. I got the wrist widget, and thank God that helped me through school. It didn't heal my problem at all, but it did help. It really did help with weight bearing, because before I used the wrist widget, I couldn't even write. I had the writing of an 80-year-old. And after the wrist widget, I could write it pretty normally. I had to write a lot. I'm a visual learner, and I think that it really helped me a lot. It didn't help the problem as far as I still needed to get the surgery. It didn't make it feel 100% better. I wore it a lot. Sometimes the pain was just so unbearable I couldn't even wear it. But it did help with anything that I had to hold. Like I said, I couldn't write. I had a problem with laying my hands down normally. I had to always have some kind of support on my wrists. I always had have something supporting it because it would hurt. I often would walk around like this, looking like I was upset or something. I didn't want anybody to come around me because my hands would hurt me. Well, my wrists would hurt me. So I'd have to walk around like this. They did get a little better with the Cymbalta, not fully. Nothing really completely worked. So I opted for the surgery, and I'm really praying that this is going to help me because, like I said, it's been 2 years. It's very frustrating to go through problems like this with your wrists, both of them. Right now, this one is not in a brace. I have been given this bigger brace for sleeping and just, everyday use until I go to therapy, just so I won't whack it or anything. I'm taking it out now. I'm trying to just, do these little up and down little exercises. But that's just, it hurts just to do that. It feels really tight in this area here. It's just really painful. I can't move my wrist like this. It just really hurts. I have physical therapy starting on the 17th of June, and this is the 7th. So I really hope that this works. I'm really, really hoping that the surgery works so I can get the right one done. My dominant hand is my right hand, so I got my left wrist done first. to see if it works. Because if it works, then I can do it on my right wrist. If it doesn't work, I'm not going to do it on my right wrist because that's my dominant hand. I don't want it to be worse. So if anybody else has gone through Tfcc experience, just, write a comment on the bottom or just, little inspiration or anything that will help. I'm really feeling down about it. It's really quite painful, and I read a lot about the Tfcc tears, and not a lot of people get a lot of relief from it, and some people have to do a few surgeries, or I'm not doing a few surgeries. If it doesn't work this time, I can't keep on doing it. It's taken a lot out of me, and I'm afraid because I used to be a dental assistant. I can't assist anymore. Now I went to school for hospitality management, and when I get a job, I can't write barely. I mean, I can do it with the wrist widget sometimes, but it's getting to the point that I've been writing so much for school. Now that it's over, it's even hard to write with the wrist widget on. It's painful. So I really just don't know what to do at this point. I really hope the surgery helps and improves it. Thank you guys for listening. Have a great day. Bye.